We have Dr. Kevin Kavanagh. Dr. Kavanagh is the founder president of an organization called Health Watch USA. Good morning, Doc.
Morning, Jack.
Is it a crisis, the coronavirus situation? Would that be accurate?
Well, not in Kentucky. Luckily, we only have 4 cases. It is, however, a crisis up in Washington State. They're kind of the epicenter of the epidemic. And what we need to do is to try to slow down the spread so it does not overwhelm our healthcare system. So that is very, very important.
And at what point will it be termed a pandemic? I've forgotten what the requirement was for that.
Well, in my opinion, it's been a pandemic for some time now, but whenever it gets officially termed a pandemic, that's more up to the politicians at this point than the scientists. The scientists are calling for all hands on deck to address this epidemic. Now, keep in mind, this epidemic is far more dangerous in the elderly and in those that have medical conditions than it is in the young. In fact, under the age of 40, your chances of getting severely sick to the point where you need a ventilator or dying is much, much less than 60 or older.
Give us the latest figures from the CDC, if you will.
The latest figures that I have is that in the United States, we're approaching 600 cases, easily over 550 cases, and we have 22 deaths.
Let me ask you this. First of the year, I think it was, or sometime just in the last few months, we had a guest on the program when you were with us that had written a book called China RX. The name of the Rosemary, I believe, was her name.
Yeah, Rosemary Gibson,
and
yes.
She has become now in huge demand. Why?
Well, because she's predicted this. A year and a half ago when she was on this show, she discussed her book and how we are very much dependent upon China to manufacture both our supplies and our medicines. And now that our supply chain is broken, we are in some trouble. And you have to give credit where credit is due. A lot of what President Trump did was getting us off the dependence of China with his tariffs will help in us addressing this epidemic.
And as far as any kind of helpful information you can give us, what do you have for us? To just wash your hands and stay away from people, right?
Well, there are a number of things you should do. If you're elderly, the CDC is not recommending that you go to public gatherings or go in the public. Elderly is defined over 60. You want to wash your hands with soap and water for at least 20 seconds. If you do not have soap and water, to use alcohol sanitizers. And if you have to go out in public and you're elderly, you really want to avoid not only crowds, but just people. Try to stay 6 feet away from individuals. And so all of this is going to help. And the other fact that's starting to come out is that smokers are at much greater risk. In fact, the Chinese state they're the highest risk category, 14 times as likely to get a severe disease. So if you smoke, please quit. That will be extremely helpful. So all of these things are what we should be doing. And of course, at this point in time, you want to avoid flying in airplanes if you're elderly, and also if you have other high-risk medical conditions. So you don't want to panic, but you do want to do things smart. Make sure you have medications. Make sure you have a few weeks of food stocked up. And again, you should have that anyways. You shouldn't be living day to day on household supplies.
Well, Dr. Kavanagh, this is Holly Brady. While you were talking, I'm sitting here and I'm thinking about all the things you're telling us to do, and if we do those things, if we follow your advice, do we stand a chance of not having it be a kind of a big outbreak here like it's been in Washington or even in New York? Can we keep it at bay?
Well, that's what I hope, and I hope it'll be where everybody will say, oh, you didn't need to do those things, no one got sick, but probably people wouldn't get sick because these things are done. Because it is primarily a disease that is affecting those with comorbidities or people who are much older, and I say primarily because you can still get it when you're young, and it is severe. But hopefully that won't happen. If you look at the Kirkland Nursing Home up in Washington State, it is a disaster up there. They had close to 80 to 100 residents. They have approximately 14 to 16 individuals that have died with the virus. And so if it gets into a nursing home where you have a high concentration of elderly and comorbidity, you will see tremendous amounts of pathology and fatalities. And so we really do need to try to protect our senior citizens. We need to try to protect those that have comorbidities. And unfortunately for Kentucky, one of the major comorbidities is smoking. And you do not want to outstrip our healthcare system, because if that's done and we do not have supportive care that we can deliver, then it's going to have a huge increase in fatality rate.
All right, Dr. Kevin Kavanagh from Health Watch USA, thank you.